Well, the reason I got into medicine really was, as most kids, I had an interest in construction, cars, things that go vroom. And as I got into school, I started to realize the human body in itself is a type of construction. There's plumbing, there's electric, there's wiring. And as I learned more and more about that, I was fascinated. And over time, I realized there's no blueprint for this. And every patient is different, and that makes it all the more interesting. Right now, the most rewarding part about being a doctor for me is my patients' lives outside the hospital and outside the clinic. I can't think of anything more rewarding than when a patient tells me something I've done for them, helped them walk down the aisle with their daughter, or help them get to a family reunion, or play a sports game that they haven't played in a long time. So quality of life is a big deal, as is the medicine that we provide the patients. The one question I wish patients would ask me more is about a historical perspective. I think after seeing hundreds and even thousands of patients, we can anticipate most of the questions they're going to have regarding their disease process and the treatment we're discussing. But we fail to often give them a perspective of how the disease was treated 10 years ago, 15 years ago, or 30 years ago. In my field of interventional radiology in particular, things have moved so quickly in the last 20 years that I think patients would be astonished to know how treatment would have been had they shown up a decade ago, and how things have progressed. That type of perspective may be helpful in easing the tensions over the treatment that we've been discussing. I'm Dr. Naishadh Shah. My mission at Jefferson is to improve lives.